Oh, thank you. Thank you guys for joining us. We are here for Embracing Redirection, Nonlinear Paths to Pharma. We are so excited to have you guys all here with us today. This is going to be a very inspirational talk. I know a lot of us are in that weird period where we're trying to pivot and figure out what our next direction is. And I think this is going to be that perfect talk for you. But before we get started on the good stuff, let's go ahead and go to that next slide because we want to interact with you guys.
Always.
Tell me, guys, where are you guys from? Type in your school and your pharmacy classification in the chat. Let us know who's in the building or the webinar.
Don't be afraid to come off of mute.
You know, we do this every time, guys. So you can imagine that every show will start by trying to get a little interaction. I'll start off. I'm Matthew. I'm from TSU. I even throw that inside. Ooh, don't have to put the
Memphis in the house.
The years.
Mercer. P3. We got a P2 Jordan. Thank you for coming.
Thank you. I don't want to even Ganika. I think it's Ganika.
It's Ginica. Yeah, it's really close.
Ginica. Oh, okay. Southern California.
Being here.
And then we got the other USC.
We love to say it. Thank you everybody for coming out. Obviously it's a pleasure for y'all being here, and we really appreciate it. University of South Carolina.
Ron. Alrighty. Thank you guys for coming and tuning in. Let's now get to the good stuff.
Perfect. So we're blessed to soon be moving into our third year. But for those of you who may not know us, and that is okay, the Pharma Collective, we are a group of students, and it's actually, I want to emphasize the fact that we're a group of students because day in and day out, there are several different organizations or there's several different resources that are kind of coming available, but a lot of those aren't kind of student ran. And that's one of our main focuses, that we are a student ran social platform that really just kind of focuses on capturing the influence that the pharmaceutical industry has on the community of student pharmacists. One of our main goals is really just to diminish some of those barriers that are seen when it comes to pharmacy students and pharma in general. And we kind of do that by just providing information as well as educating on different type of opportunities in pharma. And so we really, again, just understand that day in and day out, there's just more and more resources. So we want to move and be just more available for students and who are interested down this path. We want to just be a genuine option. Sorry, guys. But continuing that theme, for those who may not know us or who may be new for us, the Pharma Collective is made up of 4 minority students who are from 4 different paths of pharmacy, who connect due to our passion and really just wanting to make an impact in the pharmaceutical industry. We also connect on our willingness to help others, as well as whether that be students or some who are not quite students, are still trying to move into that pharmaceutical space. And we really just kind of look forward to that opportunity of continuing to do so. So once again, we thank everybody for being here tonight.
Yes, and we are going to start getting into the meat of things. Why you all came is to start embracing redirection and starting to understand that getting into pharma does not have to be one linear path. There's multiple different paths and multiple different avenues. So we're here for you and here to support you, and really excited to hear from our 3 speakers that we have today, who will be able to talk more about their stories and their potentially non-linear paths to pharma as well. So I'm just going to give a short introduction of our speakers. So first off, we have Dr. Mila Marshall. Dr. Mila Marshall was born and raised in the city of blues and basketball, Memphis, Tennessee, while on an infectious disease internship in Peru with her alma mater, Alabama State University. Dr. Marshall realized her passion for serving underserved patient populations in pharmacy. She then chose to attend Stanford University School of Pharmacy in Birmingham, Alabama, where she has now become a 2020 graduate. While in her didactic program, Dr. Marshall served in a number of leadership roles, including a 2-year appointment as the SNAFA National LMBI Chair, go SNAFA, local SNAFA Vice President, AMCP Chapter President, Phi Lambda Sigma Vice President, and several more. Oh, that was a mouthful. She has since scaled back and geared her service to student pharmacists, aspiring industry careers, and has been able to make a large footprint in these passions as a PILS Director of Industry Coaches for the PILS Protege Program. Through these experiences, Dr. Marshall has been able to showcase her desire for cultivating healthcare through pharmacy advocacy and policy. In addition to leadership opportunities, Dr. Marshall has worked in the retail pharmacy, neuro, and cardiac ICU pharmacy and research and development for 3 years. She is adamant in aiding in the refinement of healthcare while ensuring optimal patient experiences through the pharmacy platform, and is now doing so as she completes a bioresearch and quality compliance fellowship at Janssen Pharmaceuticals Incorporated of Johnson & Johnson. Next, I will introduce Dr. Adrian Santos. Adrian is amazing. I've known him for the past couple of years and have really appreciated him. Adrian has participated in a number of different research projects, working as a research associate for San Diego State University, Anson Biopharma, as well as Illuma. He graduated from Washington State University with his PharmD in 2020, and he has also served in a multitude of leadership roles, including SNAFA, where he served for, sorry, I think I said he went to San Diego State. That was his alma mater. He completed his PharmD from Washington State University, where he was also the SNAFA chapter president, as well as a national region facilitator. Again, go SNAFA. He now currently serves as a PharmD postdoctorate fellow in global regulatory affairs and labeling strategy with Takeda in conjunction with Purdue University. Okay, and last but not least, we have Dr. Nidra Chijoke. Nidra Chijoke is an area business manager in dermatology with Sanofi. Prior to her role, she worked as a pharmacy manager at Walgreens. Nidra completed a Bachelor of Science in Biology at the University of California, Los Angeles, UCLA, and gained her PharmD from the University of Colorado Skaggs School of Pharmacy in Colorado. As a student, she was involved in several extracurriculars to include the Student National Pharmaceutical Association, or SNAFA, go SNAFA again, Academy of Managed Care Pharmacists, Phi Delta Chi fraternity, and has also served as a student ambassador on her campus. In her free time, she enjoys traveling, attending concerts, and going out for brunch. So next, we will go to the next slide, and I will pass it off to Joe.
Thank you. So the first question that we have on the board is, can you tell us about your path to pharma and any obstacles you have may face throughout your P4 year when applying for fellowships? And I guess we could go with ladies first. So Dr. Marshall or Dr. Chizoke, you could go either one.
I guess I can go first. So my path to pharma, so I did not complete a fellowship. As a student, I was very interested in completing a fellowship. So kind of what Tatiana just read in my bio, I was involved with like a number of different student organizations just because I wanted to kind of set myself up for success post-graduation if I did decide to do a residency or a fellowship. But unfortunately, during my P4 year, I did not match into a fellowship. And I think I just had poor planning. I think I kind of went into my first fellowship season kind of a little bit cocky or confident because I was involved with all these organizations. I was vice president for AMCP. I was involved with SNAF. I did some research projects. So I thought my CV would speak for myself. And I kind of applied to the fellowship process pretty late in the game. So that's something that I would not recommend. Make sure you apply early on and cultivate those letter of intents very early on. But I personally did not do that just because I just had poor planning the first time around. And then I actually applied a second time because I was so determined to get a fellowship, so post-graduation. And I did kind of plan a little bit better, but I think what I kind of failed at was probably closing my interview. So I got a lot of first round, second round, even some third round interviews during the fellowship process, but I didn't take the mock interview seriously. I didn't really reach out to people as well. And so that was just kind of my personal failures that I did as a student and post-graduation. But I kind of kept an open mind when it came to different opportunities, and just kind of just being looking for opportunities that might be available to where I am now, through at Sanofi through the Leadership Accelerator program, where were seeking out individuals who were new to pharma. It's actually a sales position, so kind of going more into the sales route versus going the traditional medical affairs or regulatory affairs type of route that most PharmDs do, to kind of gain that experience and then eventually transition out. So I wouldn't do what I did as a student, but knowing that you can, obviously, which is why I'm here tonight, that there's still other opportunities or other pathways to get into pharma. And I kind of found it through sales versus going through that fellowship process.
Hey y'all. So my journey, my path to pharma, I think Nidra and I both were super involved as student pharmacists. And I think maybe that's one of the things that, to know me is to know that I am like a servant. So I was very involved, as you guys heard, in student relations and service and things of that nature, to the point where I sometimes forget to serve myself. I don't think that I had ill planning in a sense, but I was so caught up in student leadership that I learned about organizations like PILS. I think my graduation class was the first year they had the protege program, like the official protege program. And so coming from a geographically limited school, which is a school that I say is a school that has no pharma anything, doesn't matter if you go one state to the left, one state to the right, there is no pharma. You have to go north or west to get those types of opportunities. I went to an extremely residency focused school, and I saw someone from my school on here. So you understand where I'm coming from. So I think the biggest mistake that I made, which I really emphasize now, is having a mentor early on that could actually speak to where you're trying to go. I stuck with the mentor that my school provided me. And again, I just said I came from a residency focused school. So yeah, I think that was my biggest mistake, not finding a mentor that has been to the places that I'm trying to go. Get your mentors early on. P1 year is not too soon. P2 year is not too soon. It's never too soon to begin planning your career path. So I think that was the biggest obstacle that I faced. Something else that I did, which is a huge red flag, and looking back, is that taking interviewers' word over legally binding documentation. So you'll see quite often that in interviews, they will say, oh, you did great, we can't wait, we're definitely going to give you a next round. But you have to take verbal confirmations with a grain of salt. So within the time frame, I did have on-sites, and within the time that I was conducting those on-sites, I had a verbal offer that I took to be true, and I started turning down other interviews that were coming. So I think the second biggest mistake that I made is that in light of not having a mentor, when I did make it to the finish line, I considered myself to have crossed the finish line without physically signing a contract, and that's a huge no-no. So those are the two things that I would emphasize to people to bear in mind. Have a mentor or a sponsor or both someone that can help you navigate this untapped area that you're about to explore, and someone that has been there, because it's very difficult to navigate those things on your own and actually do it correctly the first time around. So it's a little bit about my story.
Yeah, so I can I'll go next. Definitely one of my biggest obstacles. So the year that I applied for the fellowship was the first year where they did everything virtual. And the time and the load management are definitely something I did not prepare for. I was applying to almost 15, 20 different fellowships, but what I didn't take account to, right, you do 20 first interviews and you'll do 15 second, or 10. And it started getting where balancing my app rotations and also, trying to apply to all these fellowships really took a toll on me. And another part with that is I'm not able to distress just because it's such a stressful moment all throughout, where by the time you're done with one interview, you're still in your head trying to decide, did I do well on that one? Is something I could improve on? And then you go on to the next one, where you definitely want a balance, where you want to make sure your mental health is intact, making sure you stay healthy all throughout the interview process, because it's long and it takes a lot of toll on you personally. Another obstacle I really felt like was so I've always wanted to do regulatory affairs, but everything that I know was just basic understanding of regulatory affairs. And I think the second time I've interviewed is when I started understanding more in depth in regards to, what regulatory affairs actually do. So I think that was really one of my biggest obstacles. With school, yeah, I came from a school that has zero experience in regards to fellowship or industry. I did end up getting an FDA rotation, but it was past December, where I really wasn't able to use it, that experience, until the second time I've interviewed. So.
Definitely. Thank you for your answers. And with that, we're going to move on to the next question that we have for y'all tonight.
It probably would help if my sound was on. So question number 2, what was the hardest part of keeping yourself motivated after your redirection?
I can go first this time. I think the hardest part for me was coming to grips with things for what they were, like coming to reality that I think one of the things that makes it the most difficult is that you're grieving, right? And grieving is hard within itself, but when you feel like it's on such a public display, especially as like a national figure, like, how pharmacy is small. So when you're a student pharmacist on a national board or on anything, lots of people know you. And because lots of people know you, a lot of people have met you before, have seen your personality, seen the work that you put in, and they consider you a shoo-in. Like, sure, if anyone's going to get it, she's going to get it. So grieving in the midst of the shame or the embarrassment is probably the hardest thing that I had to go through. And I met a coach that had gone through a very similar situation as myself. And he told me, and it was weird because this was the first time we had ever met. And he's like, I just think we should cry. I'm like, dude, what? And so here I am crying on the phone with this man I've never met. To this day, I've never met him in person. But we share that moment together because he told me, you know, I get that it sucks, but do you want to feel like this forever, or do you want to move past it and go get what you came here for? And so I think that's the biggest thing, or the hardest thing that that I had to deal with. And I say to anyone who didn't get a fellowship, or who came super close, or even if you didn't come close at all, like, accept it, grieve it, feel it, it happened, and it's okay. But know that that's not the only way to get into industry, and please forge ahead. I tell myself all the time, I'm an ex-athlete, for anyone who doesn't know, be tired later. For as much schooling and as much work as we've put in, the least we can do is like what we do for a living. Go get that career that you want for yourself.
I guess also to kind of echo what Mila said, they say comparison is the thief of joy. And I remember, like, you know, during fellowship season, even like the match season, you see everyone on LinkedIn. I'm so happy to announce I got matched into, or accepted this offer to XYZ fellowship. And you're genuinely happy for all of your peers, like genuinely happy. But at the same time, especially if it's someone that you know, or someone is like your classmate, and you're like, how did they get a fellowship? They didn't even do anything. Like, they were involved. And so you start to kind of like, it's like, I don't understand like how this person got this position over me. So you kind of like Mila said, you're kind of in this grieving, you're kind of comparing, like, I don't understand what I did wrong. What did they do to kind of get the position that they get? And for me, and I really hate to compare myself to any, because my journey is my journey. And so, and you know, you kind of take a step back, take a day or two, kind of regroup and figure out, okay, what is my next step? And I really try to see, like, if something doesn't work out, why didn't it work out? And I kind of, with my faith, I'm like, it probably didn't work out for a reason. And I think what is for me will happen. And so I just kind of take that as a learning experience, and you kind of just prepare for the, you know, let's keep it pushing. So, and especially like, again, you work hard in pharmacy school. Everyone's asking, what's your next step? Especially like during graduation, you don't want to admit that you didn't have a job offer. So you're kind of just like scrambling, trying to figure out what to do. But, and it's kind of like, that's just what you have to do. You just kind of have to regroup. I was just very open-minded. I was like, you know what? Let's do the retail route, and let's try again next year. That didn't work out. Let's try again. Let's do something else different. So it's just kind of really just have to be an open, keep an open mind, and really try not to compare your journey to someone else's journey. You can still be happy for others, but you know, it kind of helps to build that resilience to kind of continue to keep on pushing, keep on grinding until you find that opportunity that's for you.
So yeah, no, definitely keeping that motivation is definitely was an issue for me. I think, you know, like when you talk about that 5 step of like grieving, or, you know, sadness, I was at the stage where I was constantly going back and forth between acceptance, you know, where it's like, maybe it's just not for me. You know, I already have another offer to work in retail, and I'm like, you know, maybe that's where I'm meant to be. So, but every time and there's nothing wrong with retail, but every time I'm there, in the back of my head, you know, I'm like constantly thinking about what I could do to improve for the next time, or, you know, talk about somebody I've met that got that fellowship, and all the, you know, items they've learned. And I think definitely what really snapped me, you know, back into existence, where I told myself I want to reapply to this, um, was I had a dream. I know it's kind of weird to start with I have a dream, but I had a dream that I was wearing a suit in a big meeting where I was presenting to everybody. there's really no time frame or any project that I did at that time. And that's when a week later, I actually went to, my district manager for the retail I was at and my manager, and I told them, I want to try for fellowship again, you know? And I think that was like that moment where I went from acceptance of where I'm at into just being so motivated, where I actually went and revised my letter of intent, sent it out to everyone, revised my CV 7, 8 times, kind of what Mila did. I looked with all my old mentors and got new mentors as well. And overall, like just the accumulative actions that I've done all throughout that year kept me motivated. But definitely the biggest issue is always what's in your head, because your head's telling you, why go through the effort again, right? I mean, some of you guys here went and interviewed and saw how rough it was, how I've always talked about how mentally draining it was. Do you really want to go through it again and possibly have that same heartache? And my answer to that was yes, I'm willing to go through all of it. And it really just kept me motivated all throughout the process. So
Thank you guys for sharing your vulnerability at a time when you guys were facing adversity. Your resilience is empowering. I know I'm empowered. So thank you guys.
Exactly. And just all the answers have been very, very genuine. And I can't thank y'all enough for kind of creating that space. And we want the audience to feel just as comfortable and know that this is a safe place. So just thank y'all again for creating that. This next question I'm excited about because I can kind of relate to it. Coming from a school in the South, TSU, it's rare to have any resources at all about anything in industry. And I just felt like everything that I wanted to get or anything that I wanted to do, I had to go do it myself. So what resources did y'all use to help you find some of the opportunities that y'all did along y'all's journey? And I guess we can start with Audrey because the ladies already went. So
appreciate that. Thank you. So definitely resource. The big thing I did was, around January, that's when you see a lot of people posting on LinkedIn saying they were able to get a fellowship. I actually went and congratulated a good chunk of them, and then added them to expand my network, and also discuss with them, like, what do you feel like you did well on, what could you improve? And from that, it really helped me out just because I'm able to understand what mistakes I did and improve upon that. Then there's like other resources such as like IPHO. We're able to see all the different fellowships that that they different schools have to offer. So I went through that, see which one best fits. Great way for you to as well see fully understand what functional area that you've chosen. The big thing that I used a lot to find opportunities was actually my network, not just LinkedIn, but also through friends I've connected throughout the years. Since I was a first year, I've gone through almost every regional conference for SNAFA, national conferences, and I've met so many people all throughout all the conferences I've been to, even like the leadership conferences I would Fight Up to High, that I was able to reach out to them and really talk about what I could improve on. So I think all of those combined really helped me be a much more stronger candidate for the next round when I interviewed.
I think the biggest resource I used was probably I will echo and say my network, but I'll also say like my self-grit. That was the biggest thing. You're not just gonna see, and I mean you will see opportunities come by chance or circumstance on LinkedIn, or you'll hear about it in some group me chat. But it was really my grit. I had to really sit back because I was from a school in the South. I knew that I had done my due diligence to get experiences. I had an FDA rotation. I did research. I won national poster presentations. So you couldn't tell me that I didn't do what I could with what I had. So I took what I had because I told myself, okay, what you've done is enough. Let's just call a spade and say, we weren't a good fit for that team. So let's look at what we've done. I started looking for roles that were looking for people to do the things that I had done. Before I landed this current fellowship, I did land another. It was not within industry. It was a clinical research and quality improvement fellowship at a VA hospital in the same city as where my pharmacy school was. And so when you think about resources and networking, I was very transparent in my interview. In my initial interview, I told my then manager, at the end of the day, I don't see myself being a staffing pharmacist. That's not my end goal. So from a quality improvement standpoint, I will come in, I will look at your health system processes, I'll look at the way that you conduct clinical trials, I will look at quality improvement from that way and help you improve those processes. Not only will you gain something from that, but I will gain something from that I can leverage to then go into industry. And he loved that. The first chance that I got, J&J came to my hospital to create the COVID-19 vaccine. And it was like serendipity. So you have to, okay, transparency can't, sorry, I'm like not supposed to stop to read the chat, but look at me. Yeah, transparency can get you very far. And I think that's something that a lot of people shy away from. They think that if they tell their bosses the truth, like, oh, then they won't pick me. Like, I came in, I did exactly what I said I would do, and I finished a 2-year fellowship in 1 year, and I got on. I left, I was out. There was nothing left to say. So use your grit, use that desire, that passion, that all those things inside. Because like Adrian said, when you have these other roles in the back of your head, you have so much resentment with yourself for settling for what you're doing, and you're not happy. Even though I knew where I was going, I still wasn't happy in my first fellowship role because I knew it wasn't where I was supposed to be. And I say that lightly because I was there for a reason, obviously. So I would say those are the two things. And then the last thing I'll say, LinkedIn. Don't be afraid to, I'm a LinkedIn like hermit. Like you will see me on everybody's posts, hyping them up. You would think everyone's my cousin. Like I am gonna go comment on your LinkedIn and I'm gonna network with you. Don't be afraid to turn on alerts. Like if there's something specific, say you want med affairs and you don't want to yield, you don't want to apply to the reg position that just opened up, you don't want the clin dev position that just opened up, turn on your alerts and also add recruiters from those companies and share them your CV or resume and say, hey, what do you see on my resume at this time? What's missing for an entry-level role or for a fellowship role? What have others had that I'm lacking? Use these things to your advantage. Feedback is the greatest way. I mean, direct feedback is one of the greatest ways to get better. And the last thing I will say about networking and the resources that I used, the people that denied me, why? Ask them why. Do not be afraid. Thank them for the opportunity. No hard feelings. It was so great to meet you. I hope your dog Sam does well. Like, keep that connection. We don't burn bridges over here, but ask them why. What could I have done better? What positions do you think are a better fit for me? What company do you think is a better fit for me? Get that feedback and run with it. There is so much that the more experienced people can share with you to help steer you and guide you. Share it with your mentor and get after it. That is my sentiment.
just to kind of quickly what both Audrey and Mila said as well, to kind of find the opportunity that I had now, LinkedIn was pretty big when I was looking for pharma positions. But what really helped me, not only having like kind of like a an expanded LinkedIn network connection so I can see those posts and like opportunities there. I think really just having cheerleaders who knew my story, who knew my journey, who were really advocating for me, and that they kind of had like a second set of eyes on my behalf, that if I didn't see something, but maybe they came across something, they would send it my way and say, hey, Nidra, I saw this, apply. Hey, Nidra, I saw this, apply. And there was even getting to a point because I was getting denials after denials, rejections after rejections, that I was getting really comfortable in my retail position. I was just like, you know what, it's fine. I'll just do retail. But I think having the group of cheerleaders that I did have kept me going to ultimately I landed the position that I had, because probably if it wasn't for them and them also being a huge advocate, just being active on LinkedIn, I'm not sure if I would be here today, but I'm like so grateful for my close network of friends who continue to advocate on my behalf as well.
Awesome. I think the common theme for all three of you is definitely resiliency and grit. So thank you so much for sharing that. We can move to the next slide for question number 4. But before we do that, I would love to sprinkle in an audience question. I think if I'm saying this correctly, Iosai has a question. Did you want to come off of mute? No pressure. If not, we can also say it.
And that is okay. I'll go ahead and I'll read it for you. So what are some entry-level positions that one can look into for industry? He said that he's been looking into some clinical research roles, but he hadn't had much success.
So someone just, oh, do you want to go, Nidra?
I was only going to answer since I'm not in a fellowship, I guess. So the type of roles or the alerts that I initially was looking for, I was looking into like CRO positions, CRA positions, med info positions. I was not interested in regulatory affairs, so I didn't even bother to put that in my job alert. But I guess I would say I'll just kind of keep an open mind, because I don't know if you really want to do clinical research, and if you do, then I would say kind of set like job alerts for those CRO, CRA positions. And I forget the different companies, but there's so many of them, like Syneos, Icon, IQVIA, Precision Health, I think. There's like so many of them. You can kind of just set a job alert and just kind of look for, and then just kind of create it for those entry level or associate type positions. I know there's this guy on LinkedIn, that's all he posts is entry level position, Hamzat somebody, but he has like an early career finder.
Hamad.
Yeah. So he posts a lot of positions. So I followed him really closely. And I never actually really entertained sales initially, because I was like, I'm a pharmacist. What am I going to do in sales? But I think sales is also a great way to get into industry, especially since you have that clinical expertise, like understanding the disease state, the product, that would just only serve you very well. So I would say just look for, so my position as sales is like an area business manager. To me, it doesn't sound like a sales role, but it's a sales role. And then you can look for the traditional pharmaceutical pharmacy rep, whatever, specialist, and look for those type of roles on LinkedIn as well.
Awesome. So going on to the next question, did you all have a plan B for if you did not secure a fellowship? And then did that change throughout the year, throughout your process as well?
I can go real quick. Yes. I did get an offer to work for retail. Did that change throughout the year? No, that was what I did until I got the fellowship offer. So
My plan B was retail as well. So I worked in retail for about 2 years before I got the current positions that I had, because I knew that I can still gain valuable experience, and I wanted to make sure during my retail I wasn't just staffing. I was involved with setting up those COVID vaccines, rolling out, kind of doing the train the trainer projects when it came to setting up like drive-through testing for COVID testing, and which ultimately led me to getting promoted pretty quickly to a pharmacy manager, and then kind of gaining those skills. So I knew that the skills that I would gain in retail will hopefully serve me well in my future position within pharma.
I did not have a plan B. I am very stern on myself about not doing things that I don't want to do. So during this phase of my pharmacy career, I had lots of professors like, oh, just apply to residency. You're definitely gonna get that. Oh, just we're having career day coming up. Walgreens will be here. You should apply. And I knew those things had never crossed my mind. Like there wasn't an inkling of, maybe you're right about that. Like there was nothing remotely close to that. So I'm a huge advocate in failing forward. And so I've already shared with you guys, I did end up landing a fellowship that year, though it was not in industry. And just kind of like Nidra said, I took that time to expand upon the things that I had done, but also gain a new skill set for the things that some of my previous interviewers thought I might have been lacking. So direct hands-on patient experience, supporting a clinical trial and clinical trial logistics, quality and improvement. Quality is everywhere in industry. And for anyone who doesn't know what quality is, because it's such an unheard of area, I know, feel free to reach out to me and I'll fill you in. I'll give you the tea. It's a cool area. And I think the best part about quality is if you're uncertain about where you want to go post-grad, you don't know, I don't know, I could do reg, I could do med affairs, I could do either. Quality touches on all of those things: med affairs, reg, PV, ClinDev, all of it. So you, at the end of the day, get to be this really cool unicorn that post-fellowship, you can go wherever you want, versus feeling like you pre-committed to a functional area and you get there and now you're like, oh, this isn't really what I thought. And now you have tunnel vision and one set of skills. So I hope that answered the question. I did not have a plan B, but I forged ahead regardless. And sometimes that's just as good as a plan B. So, but that doesn't mean don't have one. Please get one if you don't have one. Please have a plan B.
And I think that's great to also say, like, I didn't have a plan B. I think personally as well, going through the fellowship process, I didn't have a plan B because of thinking like, okay, I don't want this to be, you know, bad luck or things like that, or manifestation, and only thinking of the positive outcome. So even if you don't have a plan B, for those who are embracing this redirection, I think it's still important to go through the process and then continue to figure out where you can land and pivot in the future. And I'm going to go to the next question and we'll pass it off to Joe. As we are also in the tail end, if there are any questions in the chat, please definitely drop them in so we can prioritize anything that you may have as well. I think, okay, so for question 5, it's what valuable transferable skills did you gain during your gap year that helped you to ultimately get into the industry? I know you, Nidra, as well as Mila, has talked about some great transferable skills that you had, but if you all wanted to add anything else additional too.
I think some other things that I was able to improve upon. Corporate speak, no one talks about it, but the way that we speak in clinicals and in pharmacy school is not the way people in industry speak. It's a completely different language. So I was able to acquire my corporate speak, saying things like KOL, KPIs, metrics, things of that nature, because I was doing it. Those are not things that I was doing in pharmacy school, but when you're running a clinical trial, that becomes part of your day-to-day being. So managing key opinion leaders as well, collaborating with sub-investigators, being a sub-investigator, just things of that nature. Learning the ins and outs and the end-to-end scope of clinical trials was something that I was able to bring to the table. And then quality insights. It's not often that, again, people know what quality is, but when someone knows what it is and it's something that they need on their team, again, you're a unicorn. People have to have you because you keep companies from losing money. You keep companies from getting sued. You keep companies from being in legal matters. Like, quality is a really great organization or functional area. And I think that that was one of the biggest assets that I was able to leverage in the long run.
Kind of wrote down a list. So I guess kind of like with my experience as a student, being very involved, and then also working in retail, like simple time management, multitasking, project management. I think that's a big thing in retail, especially if you are able to land a fellowship. You're going to be, I'm sure you're going to be handling multiple projects. I know within sales, you are kind of your own business. You are managing your territory. You're trying to drive the business forward. So if you have like a high business acumen, and then I think that kind of helps in retail, because retail is a business, like is a corporate. You have your district leader, your district manager is like, hey, you need to do 50 flu shots a day. You need to do X, like, everything is metrics, metrics, metrics. So, so kind of like, if you're able to kind of come up with a business plan, like if you were to do retail, it's like, okay, I have these set expectations that was kind of put upon my store. This is how my team and I execute it, and then we're able to meet that goals. That's really impressionable to like the hiring manager within pharma to see, like, you kind of still have that business mindset. And also communication and having high emotional intelligence is very key as well. So if you're able to kind of highlight that during your interview process, I think your hiring manager will be able to see that. And it just kind of, again, just kind of showing your leadership skills. And one thing that I would love to like really be able to improve on, and that I'm actually trying to work on every day, is kind of to master the art of asking questions. Because especially, at least when I talk to different providers, I'm trying to, I'm talking about the disease state, I'm talking about my product, and they may just have a set perception of how this product may work, but kind of just picking their brain, probing their brain, why do they think that way, and kind of be able to translate that and kind of have them think a different way. So if you're pretty good at like challenging perceptions, I think that will also serve you well as well, kind of in that MSL or sales type of role when you do kind of interact with external stakeholders.
Well, I'll kind of focus more towards, like the interview process. I think my biggest issue is, a lot of us have leadership skills or leadership positions that we've had, that makes our CV really strong, as Myla has stated. I think my biggest issue was, being able to kind of breathe through all the adversity that you have during the interview process. When you're in retail, you're juggling so many things, to make sure the pharmacy runs smoothly. And, someone might come up and have an issue, with their medication. Let's say the old Adrian might, just hold my breath, and not be able to think clearly on what the next step should be. Retail has definitely showed me that, if you just kind of breathe, it's okay if there's like that little awkward silence while you're there. as long as you're able to um, make a statement that are relevant, make a statement that feels like um, that answers their question. I think that's the biggest thing. And I think retail definitely showed me to kind of slow things down, because if you're not breathing through all the adversity that, through retail or even through all the interview process that you had, then you also are panicking so much that you don't listen to the question. So that was kind of one thing that retail has really brought to me. Another thing is, I mean, I'm assuming some of you guys have done retail. You think you have a thicker skin until you do retail. Um, Definitely, I thought I had a thick skin all throughout pharmacy school until I get those rejection letters, by not getting a fellowship. So I think what retail has done for me was when I go through one bad interview and have another interview coming up, I'm able to push that aside and not let my mood, the positivity, make sure all my thoughts and research are still in my head when I go into that next interview. And I can account that to really having a thick skin that, it's not in the back of my head too much, like any issues I had. But I do still suggest that, end of the day, do see what you did well, what you could improve on, just so that, the next interviews that you've done, you get that second, third, and you do get that fellowship later on. So
Awesome. Thank you so much for sharing. And we can go to the next slide and we'll pass it off to Joe.
Definitely. And just wanted to say a big advocate of transferable skills. So I hope like everybody was able to get something from that question. Just knowing that those skills can help you out in the long run and get you to a position, just like the three have spoken on, and like, some other people on the calls. So with that being said, last question from the night. If you could do anything different in your P4 year retrospectively, would you?
I can go for this one. Well, I mean, we've already talked so much on what we could improve on. The one thing I really wish I've done is hang out with my friends, in all honesty. With all the interviews you've gone through, you're just tired, like you just lay in bed, but you spend so much time thinking that there's even more mental burnout after all the interviews you've done. So one thing I would have done is I would have grabbed friends and be like, hey, do you want to try the new sushi in the next town? Or do you want to go to the driving range? Just so that you're able to reset and really clear your mind for the next day. Um, and another thing too is I really wish, the first time I did it was I reached out earlier to, fellows and professional in regulatory affairs, which where I'm in right now and the one I wanted to do, just so I get more understanding of the industry. I feel like I did come into the fellowship interview kind of cocky as well, where, my CV is, looks great. My letter of intent looks great. I'm good. That's all I needed. I really did wish I reached out to a lot of my connections now, just because I feel like they were my main difference between getting a second to third interview, because first interview is mostly focused on getting to know you. Once you get to the second and third interviews, fourth interviews on site, they want to see what your knowledge is in regards to what you're applying at. If you come to me, and say, I've always been interested in regulatory affairs, it's such a broad functional area that if you're not able to explain that further, it just becomes a natural, or it just becomes a statement that doesn't mean anything. And I felt like the first time I went through with it, that was my statement very broadly, you know. I love regulatory affairs. I've always wanted regulatory affairs. Now tell me why, and you know what got you so interested in it. So and yeah, I the second year I really took it to heart with, you know, everything that I've learned from everyone. And fortunately enough, I'm with Takeda and Purdue University because of it.
I see hands clapping. Plot twist. In retrospect, I don't think I would have done anything differently, because then I wouldn't be where I am now. I used to be, like I said before, I used to grieve. I used to be really upset, really embarrassed about having not landed the role that I wanted right out the gate, you know. But when you think about it, sometimes we don't, what we want is not what's best for us. Maybe at that time, right place and right time is a thing, right circumstances, all of those things. So in retrospect, I think what I would have done differently is given myself more grace, considering where I am now. It all still worked out. However, if we were to change the sentence from P4 to some other year, I think I would have done my due diligence on school selection. I think I came into pharmacy, as many people do, not realizing how much impact pharmacy has as a profession. And had I known back then that I would have wanted to do industry, I would have applied to more schools, maybe up north, or, you know, taken more consideration into that. But I don't want to instill shame and embarrassment in you guys. I want you guys to type in the chat, fail forward, because that's what we're doing right now. We're failing forward. So don't think back on whatever happened at the beginning of this interview phase. It's over and done with. We're here now. We have to move on with what we have, and what we've done is enough. Let's figure out how to leverage it. So yes, look at y'all in the chat. Somebody spelled it wrong, I think, but I'm here with you. Fail forward. This is another chance to do it. So Chastity. So yeah, I don't want you guys to have any regrets about the things that you've done. One thing, and for those who don't know, I do coach and mentor students, and I always tell them, you know, I don't want you to have any regrets at the end of this. I remember one time, Tati, if you don't mind me sharing, we both had a presentation coming up. I was about to travel for work. It's like 12 in the morning and we're both working on a presentation. She's like, I'm so tired. And I said, well, I'd rather you be tired now so that your presentation can go well later. Like, let's get the work done, be tired later. So that's something that I really like to instill in myself and all the people that I support and that I love. I'm invested in your journey just as much as you are. So I care about your self-talk. So I'm sorry, guys, I don't like this question, because in retrospect, I don't want anyone to regret anything that they've done. What you've done is enough. That just wasn't your time.
I definitely echo what Mila just said. I think timing is key. You just never know, like, there was a reason probably why you got that no the first time around. But if I were to do anything different, and this was actually feedback that I received from a couple of preceptors when during my API rotation, is just to ask more questions. I'm not sure why I'm very timid when it comes to asking questions. You'll be doing your API rotation, you're just doing the work, and you just kind of do what, just do what you're doing, but you never kind of ask, like, where can I improve on, or is there anything more I can do? So, and I never realized like how many people are cheering on you from afar. I remember like one fellowship interview that I had, and I interviewed with this person, and he messaged me offline. Actually, he didn't message me offline, but we met at another conference like months later, and he literally chewed me out. Why didn't you reach out before? I could have helped you on that interview. And there's a saying that closed mouths do not get fed. So that was one thing that I would change, is just to reach out more. For whatever reason, I feel like I'm always bothering people when I message them, whether I know them or not. But I'm actually really appreciative, because even like since I kind of announced like my transition from retail to industry, I had several other pharmacy professionals and students kind of reach out to or DM me privately. It's like, can I learn more about your journey? And I actually really do appreciate that, because I want to see everyone succeed. And I think that's everyone's mindset. It's like, we want to see everyone succeed and do well. So don't be afraid to reach out, even if you don't know them. Just kind of introduce yourself. Hey, I'm a P4, didn't match in the fellowship, but I saw that you kind of took a non-traditional route. What was your journey like, et cetera, et cetera. I think more people are willing to kind of talk to you more than you think. And I didn't really realize that, because I really was just like, oh, I don't want to bother them, they don't know me. But I think I later found out people will chew you out for not reaching out if they're like interviewing you. So yeah, don't be afraid to ask questions, for sure.
And those were just perfect responses. And we can slide on to the next slide, even though I know we are over time, so we won't continue. I mean, I would love to kind of get to everyone's questions, and I know we were kind of responding to the questions in the chat as well. To our speakers, if it's possible, could you all put your LinkedIn or your best contact information inside the chat, just so if there's any lingering questions, or if there was anyone who didn't really want to come off mute or put their question in the chat, just create that space to do so. But once again, thank you all for your vulnerability and just being very genuine tonight. It means so much. And we can go ahead and go to the next slide.
I keep doing that. Let me learn how to unmute before I speak. But yes, guys, we really do appreciate you taking the time to speak with us today and creating that safe space by sharing your journeys and insights you've learned along the way. Really, the lessons that you guys have learned are applicable to whether you didn't get a fellowship, you didn't pass a test, or really any type of adversity that we are facing. So like Matt said, I really encourage you guys all to connect with these amazing panelists, utilize the resources they've shared with you guys today, and definitely feel free to reach out to us at the Pharma Co on Instagram or the Pharma Collective on LinkedIn. We are all here to support you. But of course, we can't leave you guys without a quick glimpse of what's to come. So as student pharmacists, P4s currently on rotation, we've been able to witness some of the harsh outcomes to poor health behaviors like hypertension, hyperlipidemia, and diabetes from poor health behavior. So even though we're focused on more of the biopharma path, we want to leverage our clinical skills and make a difference in this space. So we bring to you February Fitness for American Heart Month. We're going to be drinking our water, we're going to be eating our veggies and protein, and of course working out. We're going to all do it together all month long, so stay tuned. And because there might be a little gift, so wink wink, stay tuned and follow us, and we'll keep updating you guys on what's to come. All right, everyone, I know it's already 6 minutes, so we're not going to hold you guys up. Thank you again to the panelists, and thank you all for joining us. I hope you guys have a wonderful weekend.